For more than a century, the National Urban League and its affiliates have served as the nation's economic first responders. That means we are here. We are here to respond to a pandemic. We are here to create economic empowerment. We are here to fight against racial injustice. We are here to fight for educational equity. The National Urban League doesn't exist behind the scenes. We are here on the scene in your community, fighting, training, supporting, helping, and most of all, empowering communities and changing lives.
COVID-19 has changed how we show up and show out with our family. Now it's time to take the first step that lets us get back to talking smack with a side of mac and cheese. Before we can safely come together, we need the facts. As COVID-19 vaccines become available, you may have questions. Should I get it?
Is it safe?
Should I wait?
It's smart to question. Now, get the facts at getvaccineanswers.org so you can make an informed decision when vaccines are available to you.
Good evening, everybody. I am Joe Claire. I will be your moderator for tonight's incredible event. First of all, thank you all for tuning in. I want to thank you so very much for taking some time out of your busy lives to join me, the National Urban League, and the Ad Council to bring you this important discussion on Black men's health. It is, I'm sure it's not lost on anyone who is tuning in that the pandemic and where we are now has thrown some curveballs to our lives and has made us think about things in certain ways. And Black men's health is at the top of the list. It's being discussed everywhere I go. They talk about it on the news, especially when the health disparities started showing up with the COVID virus and, cases of COVID-19. So, tonight's discussion is very necessary. And not only are we going to talk about COVID, we're also going to focus on our mental health. Matter of fact, we're going to start by talking about how this pandemic has affected our mental health and those kinds of things. I'm going to check and see if President Morial is ready. Can I get a thumbs up in the chat if he is ready to go? All of you who are viewing and tuning in, settle in. Get yourself a cool drink or whatever you need, because we're going to have a very real discussion this evening. It's 100% about Black men, but it's also about our families, our communities, those of you who care for us, those of you who are involved in our lives and whose lives we are responsible for. It's something that we really need to discuss. So sit back, relax for the next 60 minutes. We have some incredible Black men who are going to come on. They work in different fields, but they have been doing work and research that can show us, what's going on, give us the real, give us the for real information, as well as give us what resources are available to us, where we can go if we are having an issue, all of those things. Okay, it looks like President Morial is ready. So President Morial, please take it away.
Thank you so very much for the introduction. And I am so honored to be here tonight to begin this discussion on Black men's health. I got my drink here. It is water, but better than that, it is ice water. My drink of choice, my drink of health. So I'm toasting this glass of ice water to everyone. Drink water and to be healthy. So I want to thank all of you for joining this power hour on Black men's health. The National Urban League, the Ad Council, Joy Collective, and the COVID Collaborative have come together to bring you this discussion. And this discussion is about Black men and our own self-care, our own self-love, what we have to do to truly love and take care of our own health. I'm a father of 3. I'm a husband. I'm a son of my mother who still remains with us. My father passed 32 years ago from asthma. And that incident, when he passed, passed only at 60 years of age, my attentiveness, my care, And yes, sometimes my own paranoia about what I must do to take care of my own health, because his death was shocking. It was unanticipated. He was a vibrant, strong man with no other health conditions other than he had a severe case of asthma. And when it got aggravated, it was very bad. Now, here in the United States, the vaccine rollout is well underway. I hope you, like me, made the choice, balanced the pros and the cons, and got vaccinated. And it's also a good time to think back about the last year. By working together, the National Urban League with the Ad Council, with the Black medical schools, with the National Medical Association, with the National Nurses Association, with a whole host of people, now with the Ad Council and the Joy Collective and the COVID Collaborative, we came together with a diverse team of experts and leaders in health, education, and the economy to stop the spread of coronavirus, which took too many lives. We don't want it to take any more lives. And that's why we've come together. June is National Men's Health Month. And tonight we're going to shed light on Black men's health. It is not uncommon to see many men, particularly Black men, put our own health and our own health care and our own true love for ourselves low on the priority. Brothers, men, Black men, let's change that. Put our own health and our health care high on the priority list. Now, we know as Black people, we face barriers and are more likely to be uninsured or underinsured, face barriers to accessing care. And we know we have higher rates of chronic conditions like cancer, asthma, and HIV. But tonight, we want to open the door to conversations on the challenges facing us as Black men, because we want to heighten awareness of preventable health issues and inspire men to seek early treatment, to engage in preventive care, to take care of our own health. Tonight, I am joined by some powerful brothers. Thank you to all of them. Radio host and stand-up comedian who you've already heard from, Joe Claire. He's our moderator. Dr. Aldwan Tart. He's a Christian psychologist specializing in mental health, marriage, family, and relationships. Pastor James McKnight of the Congregational Church of Christian Fellowship in Los Angeles. Former NFL player Ryanundy. And the founder and CEO of Alkane Health Company, excuse me if I didn't get it correctly, a digital platform focused on Black wellness and mental health. National Urban League is proud. It's our commitment, our mission to work to empower the Black community. Tonight, that focus is on the health of Black men. Thank you, gentlemen. Thank you, brothers. Thank you, Black men. Thank you all, and thank you, sisters, for supporting us in every way that you can. Tonight, let's be empowered. Let's be aware. And hopefully, at the end of this hour, we'll be inspired and enlightened and prepared to do everything in our power to elevate and protect our own health and wellness. I'm Mark Morial. Thank you for being a part of tonight.
Thank you, President Morial. As he said, this is about to be a dynamic discussion. As I laid out before, we have he let you know we have some dynamic men who are going to come on. And if you are watching and you are a family member, if you're one of those people in the community who cares for us, please sit down and watch. Or brothers, if you are watching, please invite your family to come in and listen to this discussion. We are going to start with mental health. We're going to start with mental health and what this pandemic has done to affect our mental health. I have a wife and children, and my mental health has been in question as I have been in lockdown with them. And I'm saying it in a joking manner. However, I've had to have discussions with therapists, with people I know who are in the mental health community about, times that I felt too much stress, times that I felt this or felt that. So it's a discussion we have to have. So without further ado, let's look at our mental health. And I'm joined by our panelists for this first part of tonight's discussion, tonight's conversation, starting with Dr. Alduin Tart, who he just mentioned, Pastor James McKnight, and Ryanundy. Good evening, gentlemen.
How you doing?
I'm doing great. How are you guys? Is everybody good?
We're good.
Terrific.
And that's only your wife and children stressing you. It's not stressing us.
Oh, well, it is over in my house.
Right. You should have seen Ryan's face.
I'm down here in my basement hiding out, to tell you the truth.
Almost there, brother.
So listen, let's jump right into it because, and as I pose the question, I may direct it to one person, but please, any of you gentlemen who feel like chiming in, do not hesitate to do so. We need all perspectives. I'm going to start with you, Dr. Tart. Can you please talk about the pandemic's effect on the Black community in whole, and specifically Black men, and how they have been impacted and how we have been impacted over the course in our mental health?
Yeah, COVID-19 has not been friendly to us. It's a number of things that are affecting us. So we know that rates of suicide, 75% of all suicides, it's men. Substance abuse, 3 to 1, it's us. And guess what? We don't seek help because we don't feel like it's manly. We feel like we have to gut it out. We have to grind it out. We have to figure it out in the basement for ourselves. And so we know just this year alone in COVID, 1 million people saw screenings for anxiety and depression. And the research shows 460,000 people thought it had suicidal ideation. I mean, they thought about suicide. It got that bad, they at least thought about it. And so we look about like what's going on. So one, either your relationships or your jobs are flourishing in COVID-19 or you are absolutely struggling. There is not a lot of people in the middle. And so you think about manhood, you think about a man, you think about a Black man, we have to make sure that our family is good. But what happens when we're not good? What happens when our money's affected? What happens when you're looking at men? It's one thing you need to look at when we start talking about if a man is happy. There's a lot of things, but the number one thing is, does that man feel competent? A man who does not feel competent is a man who struggles, and that can be competent in his job, competent in his relationships. And those are the two major stressors when it comes to Black men. And so we add into that, now we have social injustice. So being Trump, so we're looking at social injustice. Now racism has been labeled as a health hazard. Like they've been able to look at it. It has the same effects as a disease. So you look at social injustice, you look at racism, you look at the stress of COVID-19 and the amount of grief that we've had to deal with people not being here anymore, being hospitalized, and then being in the same house, trying to raise children of different ages in homeschool while you're trying to work to get stuff done, and your wife is doing the same. And sometimes you just need a little space. Joe didn't say it. Ryan didn't say it. Bishop didn't say it. Sometimes you need a little space.
I'll say it.
There it is.
I will.
Well, how do you say that? How do you say it? So when we look at all those factors as a man, how do we say that? How do we communicate that, I'm struggling? Do we have permission to struggle? Do we have permission to actually say, I don't have this figured out. I need you to do some things. And so we look at most Black men see themselves as the anchor, not only for the family, but also for the community. And so a lot of times, because we see ourselves as the alphas, as the helpers, we're the ones who don't like to seek help because we are the helpers. So who helps the helpers? It has to be other helpers. And it's not. And so I want everyone else to chime in. We're the ones that don't get help. That's why suicide is elevated for us. Whereas a woman will reach out and say, hey, I need some help with this. I can't figure this out. We have a sense of shame. We feel like, we have to grind it out. We have to figure it out and then present it to others.
Man, you said something incredible when you said, do we have the permission to struggle? That one hit me. That one hit me in my heart because, do I have the permission from the world to actually be needing
Joe,
something? To actually be needing
something? I think that's the wrong question to ask, Joe. Do we need validation or permission from the world when it really starts with self, right? Like that's my view. If I'm not giving myself permission, then how can I expect the world to give me permission? And so, that I just have like a fundamental core belief around like starting with self. And so, and self-advocating and making sure that, if I need something, then I have to be proactive about getting it.
Gotcha.
Hi, everyone. I'm Ryanundy, founder and CEO of Alchemy Health. Sorry, I just dove in there. But yeah, Aldewan made really great points. But I do think sometimes we hold ourselves to a standard and look for that external validation. And really, we're taking that journey inward is one, intimidating and scary to like really uncover some uncomfortable truths and learn more about yourself and really get comfortable with yourself and who you are. But then on top of that, like saying like, look, I am enough. And if I need this, then that's okay if I need this. And I'm not looking for external validation or permission to do that because I'm prioritizing myself and not feeling guilty in that moment. That's something that I had to really work through and get comfortable with. Because at the end of the day, as the helper or the helpmate of my wife, I look at the things that I do around the house. I look at the things that I do for my family, and I have to be happy with that, right? And I don't look for external validation with that. External validation and words of affirmation are nice from my wife, but it has to start with me. Like, am I happy with what I'm doing around here? Is that bringing me joy? Is that bringing me fulfillment? And ultimately, I think that sense of understanding and really becoming comfortable with self, I think is a really important narrative for us to not only acknowledge, but continually work on.
Thank you, brother. With your organization, Ryan, we talking about that negative stigma of seeking help, especially among young Black men. What resources does your organization provide to help get rid of the stigma and help us say, I'm enough? What do you do to make sure that I get the realization that I'm enough?
Yeah, I think from our standpoint, this is a lengthy conversation, but in a nutshell, when we think about the Black community as a whole, we've had a checker pass in a relationship with the healthcare system. So it really starts with our brand. Like if I can't even look at a company and see myself or see where I fit in, then that's a non-starter for a lot of folks. So we really start with the brand. But when we talk about what can I do for myself or how can I like self-advocate, our whole platform is devised around like self-care, content, products, and tools. And so we offer video on-demand therapy modules. We have guided meditations. We have affirmations. We have a laundry list of like self-care products and tools that really sit in the gap of like the mental health spectrum. And the general thesis around it is saying like, look, there's yoga, there's meditation, now there's Instagram memes, and then it's a very big jump to go see a therapist. And in between, there's a lot of access barriers, and particularly they're compounded for our community, right? And so we look at it and we say, less than 4% of clinical professionals are Black or of color. Again, that's a starting point for pretty much our community. If I'm going to go seek help, then I want to find somebody who looks like me. Really hard to do that. And then once you do find somebody who looks like you, it's cost prohibitive. there's scheduling constraints, there's time constraints, there's just geographic constraints. There's a lot of things that when you put them into a bucket, and again, look at it through the lens of our community, it's really, really hard to seek the help that you're getting, even if you're self-advocating. And so at Alchemy, we decided to take this on head on and create a platform in which you have unlimited access to mental health and self-care products, tools, content, etc., all available on your smartphone, and really putting it in your pocket and allowing you to move at your own pace. And it's a palatable entry point to improving your overall well-being.
Impressive, brother. Very impressive. Reverend McKnight, what are some ways that we can help our families and friends, especially young people and other men, to manage our mental health?
Yes, a great question. And let me just thank you, Brother Joe. You're doing a wonderful job, fellas. I'm enjoying being on the panel with you. The question is, what can we do? There's a section in the scripture. It features a prophet by the name of Elijah. And in the text, he says, "It's enough, God, just take my life." Elijah is suicidal. Mm-hmm. And in that passage of scripture, what you find is that the prescription involves something physical, something spiritual. What's missing is what we really need as brothers is the professional. Quickly. The spiritual side of it is make sure that there's proper prayer, there's proper faith community. We all can have a faith community. We can all seek the Lord. We can all esteem others more highly than ourselves. That's the spiritual piece. But here's the piece that, brothers, we really got to work on. It's the physical piece. In that Elijah story, the word of the Lord is take some rest. You look at it in 1 Kings, I believe it's chapter 17. Take some rest, and then there's some food. We got to pay attention to those mundane things, fellas, because that does affect our mental health. So again, the spiritual side, the physical side, but the most important one for us is the professional side. Because some folks say, man, you just take that to the Lord and leave it there, and Jesus does work it out. But I found out that 63% of us, Black folk, we feel that getting some help from a professional shows weakness. I said, nah, check that. It's not weakness, it's wisdom. Maybe, just maybe, what God is doing is sending prepared folks who love us as people who are trying to help us. Folks like our brother who is doing that kind of work in a professional way. So again, professional, spiritual, and physical. To me, that's the three-legged stool. If we sit on that right, brothers, we'll be better and we'll help our families for sure.
I completely agree. Since we're dropping scripture, we look at Proverbs 15:22. Plans fail for lack of counsel, but with many advisors, they succeed. So we have to change the marketing behind mental health. You're not weak for seeking help. You're wise. Presidents have cabinets. Presidents and universities and companies have board of directors. You're sitting down with someone to get wisdom because you're the CEO of your life. You're the CEO of your family. And there are a lot of brothers out there who have to provide not only for their family, but for entire communities. Entire companies are depending on us being successful. We have payroll, entire churches. So that means that we have to change our mindset around getting help. There's nothing manly about struggling and stressing out your wife. There's nothing manly about struggling and being irritable and not spending time and snapping at your kids. There's nothing manly about getting a drink. I was so glad to see President Morial have ice water. There's nothing manly with like getting a drink. Like, okay, fix the problem, drink. That's not going to solve the problem. It's just going to get you drunk. It's just going to get you high. But when we start talking about men, that's how we fix problems. But the way we should do it is to actually seek counsel. And here's the way to do it. Don't ask men if you're good, because what are we gonna say? I'm straight. I'm good. I'm fine. I'm fine. I'm a king. I'm in the church. I'm blessed and highly favored, right? I'm lying. I might just got fired. I'm still gonna say I'm straight, right?
I'm broken and wounded and hurting.
If Ryan asked me if I need a spot in the gym, I'm like, I'm good. I'll let the weight crash on my chest first. That's just how we're built, right? It's just how we're built. But what you ask a man, then I'll get out of here, is on a scale of 1 to 10. How good are you?
I like it.
You'll find men say 3, 2. One, I'm sleeping on the couch at my boy's house. So if you ask on a scale of 1 to 10, that's how you get men to emote. But when that man gives you that number, you have to ask him, hey, what would make you happier? You don't ask him what he needs, because we don't need anything, right? What will make you happier? What will make you feel more competent? What will make you feel like you have more support? I've seen brothers straight up cry because they said, no one's ever asked me that. Everyone's always asking me to do things, but no one, especially helpers, especially alpha males, no one ever sits down and asks me how I'm actually doing and spends the time, brother to brother, to actually listen.
Can I just throw in one thing real quick?
Of course.
Because look on the screen right now. There's a panel of 4 brothers. We're in community. So I just want to drop this out. As we're trying to help our fellow brothers, just ask the question, yo, who do you want to live for? Who do you want to make sure that you're around for? Because if this thing spirals out of bounds even further than it is, that son, that daughter, that spouse, that mother, that friend will severely miss you. So let's get ourselves together so that we can be blessed for ourselves and blessed for the folk that we really love, because community is strong.
Gentlemen, I wish I could sit here with you guys and continue this, but I have to move on to the next panel. Thank you all for taking some time. Thank you all for your great insight and answers. And I applaud it. Thank you very much, man. I appreciate it.
Thank you. Outstanding. It was a joy.
I'll be in touch with some. I'm going to call y'all after we get done.
We'll be praying for you, Doc.
Yes, indeed. So we talked about our mental. Let's talk about our physical health. It's time to reflect, on what's going on with us physically. I'm at that age, if I could share just a little bit. I just got my first colonoscopy results the other day, and it was a traumatizing thing, but it was one of those things that I had to do. I had to get it done. And I heard all of the jokes and everything else, but I felt so much better that I did get it done. And, I felt very, very proactive, and it's led to me making about 3 or 4 other appointments with other caretakers to advise me on where I am in my physical. So how about we introduce our next panelist, Dr. Claiborne Childs, who is the medical director of hospital medicine services at Penn Presbyterian Medical Center. Hey, you good? Got to work on that audio. I'm gonna bring in the next panelist, Dr. Walter Orense, aka the Pit Pharmacist.
That's fit.
The fit pharmacist. Gotcha. My fault, Walt. I pray. And did I say the last name correctly?
Yes, Aransai. Yes, sir.
Aransai. Yes, indeed. And then Ted Obey, a 3rd-year medical student at the Icahn School of Medicine at Mount Sinai. Hey, Ted.
How you guys doing?
We're good. Thank you for being here tonight, each of you. Please, once I put the question out, don't hesitate to jump in and answer. So what are the biggest challenges Black men have faced in maintaining our physical health? And have they gotten worse during this past year in this pandemic? Our hypertension, diabetes, those kinds of things. What's the biggest thing that we're facing? Any of you can answer.
Well, I think the biggest thing that Black men are facing is the lack of education and the knowledge that's out there. For Black men in particular, I mean, this COVID thing has been exemplified. You see the health problems that plague Black communities have been magnified because of this pandemic.
Right. I
mean, so in my profession, I'm a pharmacist, so I see a lot of patients every day. I know for Black people in our Black community, there's a lot of education that needs to be brought forward to our community. Things that plague us, like high blood pressure, diabetes, high blood pressure number 1, of course, and getting knowing how to exercise, how to eat right, what to eat. Like for one example, American Heart Association recommends about 150 minutes of physical activity or workouts activity a week. That's only 20 minutes. 20 minutes every day. So I mean, those tidbits of information like that can go a long way to help people in our community.
How do we get that education out? If that's the biggest challenge, how do we start to make that the normal conversation? Like, how do I make that 20 minutes the normal, cool conversation to have?
Yeah, I think I could chime in a little bit. I think for education purposes, I think that has a lot to do with access. And I think healthcare access has always been a big issue, if not the issue for Black men. And it's definitely getting worse during the pandemic. As it stands, Black men are 2.5 times more likely to die from prostate cancer. However, Black men also receive less screening. They're more likely to be diagnosed with a later stage of cancer. And they're less likely to have health insurance, more likely to be of lower socioeconomic status. We have less access to nutritious foods. So I think it's a multifaceted issue, and all these factors can't be ignored. We acknowledge like challenges like education. So access to healthcare requires alignment from many different stakeholders. I think that healthcare providers should be the protagonists in educating patients about their health and ways to get access to health insurance and other social terms of health. So I think in my role, I've been trying to address these social and structural terms of health. About 2 years ago, my team and I founded the Diversity Innovation Hub, which is a Mount Sinai Health System venture aimed at supporting innovation to address social and structural terms of health in the communities of color, including Black men. And this is a first of its kind for a health system because we are intentional about making that connection and educating and creating resources and innovation to address barriers like education, housing, food insecurity. Some of our success has been mostly in part from making connections with community leaders. So I think first, from a healthcare provider perspective, we need to be active and reaching out to the community members and really trying to do our best to educate them and creating resources that to better support their needs.
Got you. Let me ask you guys a question. Is our physical health connected to our mental health?
Joe,
and if it is, can you explain to the audience how?
Can you hear me, Joe?
Yep.
All right, I'm back. Sorry about that. You would think after a year of this, I'd get down the unmuting to start a conversation.
We all have problems. You see how bad my lighting looks, man? We all have problems.
I got the lighting. What I would say is this is a firm yes. It's absolutely. There's lots of studies that show that when one of those things is bad, the other tends to follow. People that tend to be in poor physical health, or have uncontrolled chronic medical conditions like diabetes and heart disease, we tend to see higher rates of depression and anxiety. Conversely, in a patient who's facing, mental health challenges like depression, anxiety, they tend to have physical consequences of that disease as well. Another example I can think of to sort of help, kind of make the connection between mind and body. If there are any runners in the audience or anybody who likes to do a lot of cardio, sometimes we talk about something called the runner's high, right? So you're in a period of exercise, you get this really, euphoric feeling. This is all, it's tied to endorphins. It's your body's kind of response, when you're exercising, when you're doing a lot of cardio, and you feel good. And this is why, we encourage exercise for everyone, for physical health, for mental health. It's an important part of it. And it's because that connection between the mind and the body is so intertwined.
Got you. What's the most important thing we can do for ourselves and our families around our physical health? Anyone?
I think the most important thing is getting your physical, getting your checkups. I mean, for our community, it's good to think of your body is not like a car where something goes bad and then you want to address it. We have to be proactive in our health. We have to be preventative healthcare. That's the term we use in the medical community. Preventative healthcare. So getting your physical early, getting your screenings. I mean, in the pharmacy setting, we do basic screenings like cholesterol checks, diabetes check, things like that. So getting those screenings, getting your yearly checkups, being proactive, being intentional in trying to learn and get information with physical health, getting your family involved, walking outside for a few minutes with your spouse, for a few minutes a day or every other day. signing your family up for at the local gym in the community. So, things like that is small little things can go a long way in preventing a lot of these ailments that affect us.
Thank you, guys.
Yeah.
Oh, go ahead.
Oh no, I was just gonna say, like, I think the last thing I'll say is that I think every single person, everyone watching, has the opportunity to empower those around us, especially those within our community, family and friends, to engage in healthy behavior. That could look like simple things like deciding to play basketball instead of watching TV all day, or it could look like ordering 2 drinks instead of 6. So every day we could choose healthy behavior, and I think that we all really have the power to encourage everyone in our community to do the same.
Thank you so much, Ted. Thank you, Dr. Walt, the fit pharmacist, and Claiborne Childs. Thank you so very much, gentlemen. I really, really appreciate it. We have to move on to the next part of our discussion. And before we get to that, everybody, we have a video from the Ad Council. It's Up to You campaign. I want you all to check it out to help us get informed, to seek the facts about COVID vaccines. Check this out.
It's been difficult because I hadn't been able to see my grandchildren.
I can't wait to get back to field trips with my school.
Not having to think about putting on a mask.
I really can't wait to get back to life, really.
I miss all my friends. I miss taking pictures in school.
An expression on someone's face when you do something nice for them.
COVID-19 vaccines are available, and they're the first step to safely getting back to things we miss most. Visit getvaccineanswers.org so you can make an informed decision about COVID-19 vaccines.
Listen, as President Morial said at the top, you have to make an informed decision for you and your families. I made that decision. I am fully vaccinated. Yes. But I heard all of the stuff that was flying around in our community about getting vaccinated. So let me bring in my next 3 panelists who we're going to speak on this COVID-19 vaccines, the what's and the not what's. First is Dr. Robert Drummond, physician scientist and lead clinician and director of laboratories at Montebello Urgent Care Center at Optum. Hey
there, how you doing?
I'm good to see you again, man.
Good to see you.
And from one of my wife's favorite shows and one of my co-hosts' favorite shows and one of Black America's favorite shows, P-Valley, Nico Anand is joining us. Hey, man.
What's good, man? What's good?
What is good down at the Pike? And
you already know.
Yes, indeed. And the president and CEO of the Indianapolis Urban League, Mr. Anthony Mason, is joining us.
Good evening, everyone.
How's it going?
Going well.
Gentlemen, so, we're coming out of this and we've heard everything we could possibly hear in our community about this vaccine. So much so I remember 5G was causing COVID. Anybody remember the 5G?
Yeah.
5G gonna get you, bro. Put the phone away from you before you catch the COVID. So, Dr. Drummond, what is the latest information on COVID-19 vaccines that Black men need to ultimately know?
Well, I guess the latest information that's come out, and it's really come out via a lot of the statistics and the studies that they're looking at, has to do with vaccination and then susceptibility to some of these variants that are out. And so there are actually really good graphs that are out there that show you in areas where there's high levels of vaccination, there's low transmission of these new variants. Areas where there's lower levels of vaccination, there's higher transmission of these new variants. And this is very consistent with what we've thought all along, in that we know that we get very good protection from COVID-19 from the vaccines. And the hope was that the vaccines would really do a good job of helping to protect us from these new variants. And that's proving to be true.
Love it. Nico, how did you make your decision whether to or not to be vaccinated?
Well, I am fully vaccinated, and it actually came out of from Twitter. I had asked a couple of my friends before I was leaving LA to come back to film season 2. And I was like, I can't find a place to get the vaccine. And the Los Angeles Urban League was on Twitter and My building manager, she hooked me up and was like, "This is the link." Blah, 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 blah. I put it in, put in my zip code, got all this stuff, and I went and I got my situation down at the Fox Hills Mall. Yeah, so it was really cool, simple. You know, waited in line a little bit, but it was something that actually just put me at ease. That allowed me to feel like, oh, I can go check in on my mom. I can see my dad, you know, who actually did catch COVID back home. So, like, you know, having gone through the process of having family members that have been affected by it, I wanted to protect myself to be able to, one, engage and see them, but also get back to work and life as well. So
I love it, brother.
You know, walked around the mall for about 30 minutes, you know, and I was good to go. At first, I was a little hot. I was like, oh, God, you taking me out? You taking me out? You know? But, you know, I got it together. I was like, oh, no, you just ain't been outside the house walking and exercising like this in a minute. So that's what that was.
Got you. And that man said the Fox Hills Mall. I immediately saw the Trey and Doughboy.
Yeah, it was right there. It was so convenient. It was kind of crazy that it was like, that I was on Twitter looking for something that was such a life-affecting issue, you know. But, you know, social media, it does have its benefits.
Love it. Brother Mason, for many people, there are several barriers to getting the vaccines. How do we provide fair and equitable access to all?
Well, what I can tell you is we've been very fortunate here in Indianapolis, and hopefully this is occurring in other cities where healthcare entities and organizations are partnering with local nonprofits, especially local churches, grassroots organizations, and neighborhood-based community centers to make sure that people have access to vaccinations, that they're in neighborhoods, near homes, near where our people live, if you will, to ensure that that happens. Also doing things such as pop-up vaccinations in community parks on Saturdays and things of that nature. Also leveraging trusted leaders from the Black community to really serve as spokespersons for the efforts. Because as you know, sometimes people may be motivated or inspired to get vaccinated because they trust who the message is coming from, and really doing other things such as trying to make sure that people have access to free transportation, bus passes, gas cards. Because as you know, a lot of families struggle in part because they don't have access to transportation. And so sometimes it's those little things that really make a difference.
Yes, indeed. Dr. Drummond, if any, what are the long-term gains? Because, you know, we talk about it. What are the long-term effects of these vaccines? You know, everybody's saying, well, they made it so fast, and how do I know it's even real? It might be fake me out juice. So please, if you know of any, would you please tell us of the long-term effects of these vaccines?
Well, first, anytime anyone mentions the word "they made it fast," even jokingly, I have to remind them this was a 20-plus year process that involved a whole lot of hard work, serendipity, and just luck for us to get to the point of having these vaccines when we had them. The short answer is that we don't know, right? Any doctor that tells you that they know what the long-term effects of these vaccines are going to be, they're lying, because they've only been around for a little over a year now, right? And so what we try to do is continue to look at this, what I call a risk-benefit scenario. And that's what it's down to. It's down to risk-benefit in terms of morbidity or harm, virus versus vaccine, and then risk-benefit in terms of mortality, virus versus vaccine. And the risk-benefit is always going to favor the vaccine over the virus, for this particular virus, because of, you know, how deadly it is. And I know some folks say it's not as deadly all the time, but in certain groups and in certain individuals it is, and we just don't know who those individuals are. But we don't know what those long-term side effects are. We continue to monitor. We're going to continue to monitor. And that's why you see one of the things that recently came out, the CDC said, let's take a pause and let's talk about this issue of myocarditis and pericarditis, right? So that's inflammation that can happen around the heart, either in the heart muscle itself or around the sac that's containing the heart. Well, myocarditis and pericarditis happens, right? And it typically happens after a viral infection. Interestingly enough, we're not seeing the virus actually infect the muscles and cause this, but we are seeing this phenomena happen at an increased rate compared to the normal population after the Moderna and Pfizer vaccines, and specifically in men, younger males. So what does that mean? It means that after they went back and looked at all the data, they said, we still believe that the benefit is greater than the risk, but we do want to add just a warning label. Just like we have warning labels on anything else, we need to be transparent. We want to add a warning label. Hey, there are these rare cases, and it's still very, very rare cases of heart muscle inflammation that have been reported with this vaccine. So that's one of the things. I'm all about informed consent. We should never hide anything. So if we see something like this, we have to continue to update it. And I think they've done a good job of that.
Got you. Nico, what do you tell, the other brothers, and I'm sure they talk to you about it if they haven't been vaccinated, what do you tell them, the ones that are hesitant about getting vaccinated? What's the conversation like coming from you? You're a popular guy, as they said it. It often, the messenger can actually prod someone to getting it done. So, what do you tell them?
The conversation is actually very much so about like the risk value. What is it going to be like if you don't get the vaccine, but you want to go out and see your family, or you're interacting in certain ways that's going to bring about a high risk factor of you bringing it back home to mama who got the sugar, or your auntie, like real talk, like
I hear
have
you.
people that are really affected by this illness, and what is it, OCP, the congestive heart failure. There's a lot of just different ailments that run high in our community, but you want to be out and going to the party, or you want to go, and going to the club. I think about like you getting this shot. If you have been doing the other things that will, get your health on track, it just helps, and it just helps the family at large. But I will also say it's opened up a lot of conversation around other issues, like you guys were talking earlier about the mental health, just in general physical health, getting your PSA checked, all of the different things that I think that a lot of times we as brothers don't always do for many, 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 many different reasons, So it's no fault, but I do feel like this is just a time where we have to take responsibility and action to, and take the power in our own hands to get our own health.
Thank you. Mr. Mason, what are you doing what is the National Urban League doing to help fight against COVID-19, number one? And what are you doing about COVID-19 vaccine education and access?
Yes, so the National Urban League, in partnership with the National Action Network, also the National Coalition on Black Civic Participation, and the CDC, we're partnering with them and our 90 affiliates to promote the All In campaign. Really, the All In campaign is about making sure that we have this call to action for community members, Black community members specifically, to consider vaccinations, and also to make sure that they have access to information from a trusted source. As you know, there's so much misinformation out there about the COVID-19 virus, let alone vaccinations. And so we have to make sure that we're doing a better job collectively about educating people and making sure that they make truly well-informed decisions about whether or not to get vaccinated. And we talked a little bit earlier about making sure that vaccinations are accessible. And so a number of Urban League affiliates have actually hosted vaccination clinics here in Indianapolis. We hosted a vaccination clinic in partnership with Walmart, where over 4,000 people received the Pfizer vaccination here on site at our Urban League affiliate. And we're also looking for other healthcare entities to partner with to execute vaccination efforts. We have also participated in a number of campaigns, one with Indiana University Health, also with Eli Lilly & Co. And then we partner very closely with the Marion County Public Health Department here, which is led by Dr. Virginia Kane. And she has played a major role in educating the community and encouraging mass vaccination efforts. And so, there's still obviously lots of work to be done. Here in Indianapolis, only 39% of all people are vaccinated. Only 23% of African Americans are vaccinated. And so the hesitancy issue is real, not only here, but of course, all across the country. And the Urban League, National Urban League and its affiliates stand prepared to help address that situation.
Got you. Dr. Drummond, you spoke about the variants, and we keep hearing about the variants. And every time we hear about a new variant, another piece of urban rhetoric starts in the barbershop or, online. Here's a new variant. I told you it's coming. So if you got vaccinated, this variant's going to get you. Could you expound on, talk a little more about the variants and what we need to know? One, just how they come about, and then what we need to know about the latest variants.
Great question. Okay, so when it comes to the variants, this is all still the same virus, okay? We're still talking about SARS-CoV-2. But when the virus replicates, every time it makes another copy of itself, sometimes it makes mistakes. Now, some of these mistakes will make the virus weaker, and that version of the virus dies out. Some of the mistakes don't do a whole lot. Some of them will make it stronger. And that's just kind of the whole idea of survival of the fittest, right? The virus is just trying to survive. That's what it's trying to do. And by making mistakes, it can make some mistakes that help it survive. And what I mean by help it survive, it may change the configuration of the protein on the outside, allowing it to bind to our receptors more easily, allowing it to invade more easily, increasing its chances of survival. And so that's what's happening. All viruses do this. Some viruses do it very, very rapidly, meaning they mutate very rapidly. Some viruses mutate a little bit slower. And so in general, coronaviruses, they just don't mutate the way like influenza virus does. And so when we hear these variants, new variant Delta and Gamma, these are all just small mutations during the replication process, some of which are helping the virus enter the cells and invade a little bit more quickly. The good thing, as I mentioned, is that we're constantly looking at these vaccines, which were created. Remember, these vaccines were created back in, the original version of the virus. But what I constantly tell folks is that our immune system, what we're trying to do when we give you a vaccine, we're trying to build 3 parts of your immune system. Everyone talks about antibodies, antibodies, antibodies. It's 3 parts. It's antibodies, B cells, and T cells. Think about that. And so even if these antibodies that are trying to bind to the outside of the virus and neutralize it, even if they are less effective because of the mutations, the B cells and T cells that your body have are still able to kill the virus in other ways. So that's how immunity works. And that's why even when these small variants come out, a properly, and I guess you would say a really effective vaccine is going to be able to still provide you a lot of protection, even against little small mutations. And that's what we're seeing play out right now.
Got you. Okay, that's good to know. That's good for the conversation, Nico.
Yeah.
Let me ask you a question. A lot of brothers don't want to. They want to get the shot. They found out I had the shot. They found out I've been vaccinated. And then, of course, while I'm in the shop, in the barber shop or whatever, there's jokes and all this other stuff. And then they'll pull me to the side by themselves, and they say, "Hey man, all right, listen, I'm trying to get the shot. Listen, what did you have some side effects, Joe? Nico, since you're here with us, fully vaccinated, and everybody loves the pank, did you have any side effects, man? Anything to speak of? If you did, what were they, and how long did they last? And I'm really kind of asking to put everybody at ease, if you can."
Yeah.
Or as many people as we can at ease, put them at ease.
You mean you don't want to hear about that 8th toe that grew?
Right. I don't need. Don't bring that up.
No, y'all, for real. Like I said, when I got the shot, it was really cool. They had a waiting area after the shot was administered into my shoulder, and I sat down to make sure that you were observed for 15 minutes. I'm not gonna lie. That was the time I said, let me check my emails and let me make responses. I want to sit here for a good 25, 30 minutes, let me make sure that nothing goes wrong. So I could have nurses at my aid. And after about that, like I said, I walked around the mall for a minute. I was checking, I was going to get me some new sneakers and a new fitted. And I did that for about 30 minutes. And like I said, I did get a little hot, but it wasn't anything, and I have not had any side effects or anything like that. My nerves got to me, like those fellas in the barbershops. My nerves got to me, especially when they were had the pause on the Johnson and Johnson vaccination. I was like, oh my God, am I gonna get blood clots? What's going on? Like my brain was going. I was like Tuskegee all over Tuskegee, and I feel like really being educated. And listen, not letting my imagination run wild, right? we have all been through so much during this whole coronavirus and the pandemic in general, right? And it has done a number on our minds. But we really, I feel, mentally just have to be able to have that prayer, like, one of the pastors were talking about on the previous panel, but also get the mental and the physical really working, because being stagnant for a long time, that's an idle, that's the playground right there. When your mind is idle, it's a lot of things that can come and get you. But I haven't had any side effects. I have been in best condition, losing weight, the quarantine pounds is coming off, so I feel good. I feel good. Real talk.
I love it. Gentlemen, I wish we could sit here and talk, but we've come to the end of the hour, and I got some other things that I need to take care of before we get out of here. Thank you so very much for all of the information you've given. I'm sure our audience got a lot out of that. Thank you very much, guys. Appreciate it. Nico, I see you at the paint. Anyway, everybody, in closing, I want to thank all of our guests. I want to thank everyone who stopped in. I'm sure that you guys learned something and got some insight from them. You each did an amazing job, gentlemen. We're giving you a round of applause. You made Black men look good tonight on the internet. We didn't have any arguments, no beefs, no fights, no nothing like that. We have pulled together a list of resources for you to help you across the various areas of Black men's health. They're right here on the screen. You can check out NUL.org. That's the National Urban League. I'mAllIn.org. Get VaccineAnswers.org. ManageYourBP.org. Do I have prediabetes.org. Check each of those out if you need to. Use your phone. Matter of fact, if you have your phone with you, just take a picture real quick of this slide. And look what else we have for you guys. We want your feedback and everything else. Please take a minute to give us feedback on tonight's event by taking this brief survey. All you have to do is you see this code. All you have to do is hold your phone up to it, and it'll take you right there to it, so that you can give us feedback on if we need to do this again, how many of these kinds of conversations we need to have, if Joe Clair is the ultimate greatest host you've ever seen in your life or not. And we would really appreciate that. And as you can see on the slide, this is a URL and a QR code for the survey. Grab your phone to take a picture. And on behalf of the National Urban League and the Ad Council and the COVID Collaborative, thank you again for joining us this evening to discuss Black men's health and what we all can do to lead healthier lives. As we end, we have 2 more videos for you to view. I want you to check them out. And remember everything you heard here tonight. Spread it amongst your coworkers, your friends, your family, and everybody else who didn't get to tune in. I'm going to leave you with these 2 videos. Thank you so very much, everyone. Go have a great night. I'm Joe Clair. Peace.
For more than a century, the National Urban League and its affiliates have served as the nation's economic first responders. That means we are here. We are here to respond to a pandemic. We are here to create economic empowerment. We are here to fight against racial injustice. We are here to fight for educational equity. The National Urban League doesn't exist behind the scenes. We are here on the scene in your community, fighting, training, supporting, helping, and most of all, empowering communities and changing lives.
COVID-19 has changed how we stomp the yard and feel the beat. Now it's time to take the first step that lets us get back to strolling instead of scrolling. Before we can safely come together, we need the facts. As COVID-19 vaccines become available, you may have questions.
Is it safe?
Should I get it? Is it free? It's okay to have questions. Now get the facts about COVID-19 vaccines at getvaccineanswers.org so you can make an informed decision for yourself and for your fam.